Good morning, Dr. Rizwan.
Good morning, sir.
Today we have a special person with us, Dr. Rizwan Khan. He's a special in multiple sense. He's a very well accomplished medical professional focusing only on sports. He has helped several athletes and sports person in various different situations. While he's a practicing sports medicine doctor from Mumbai and seeing several patients and helping them on a daily basis. He's also a sought after cricket sports doctor. He has been a team doctor. He has served multiple IPL teams. I think about 3 years. Rizwan, you did with Delhi Capital, and then couple of years with Gujarat.
3 years actually with Gujarat Titans, and this is only my fourth year.
Very nice. And also, all of us vividly remember 2023 One Day World Cup. He was a team doctor for Indian team.
That's right.
And as you know, it's a very long tournament, and then Indian team performed extraordinarily well till the finals. So welcome, Rizwan, and it's as usual. It's nice meeting you. And so, Rizwan, just to quickly kickstart our discussion, I just wonder when you say sports doctor, team doctor, it's an IPL team. What a team doctor does for an IPL team? Because you have the player to play a match, then you have head coach, batting coach, bowling coach, various support staff. But as a team doctor, do you manage, like, what do you do to manage fever, stomach ache type of stuff? Or you manage their physical needs? Or what actually a team doctor does for an IPL team?
Firstly, thank you so much for having me here, Girish sir. I mean, when you told me that you wanted to call me for a podcast, sounded very interesting to me. Uh, so this would be my seventh year in the IPL, and the way I would put it is that there's been a lot of learning on the job for me as well. But to cut a long story short for you, you see what happens is international cricket goes on all year round. Different places in the world have different uh, tournaments going on. Players are all there, and suddenly in these 3 months of IPL, you have people from every corner of the world put together, and we sometimes literally don't even have 7 days before we are put up for a tournament. So it becomes a challenge in terms of players coming from different part of the world, and also our own country, India, is such a vast and diverse place. If you're coming from the north, you're coming from the east, you're coming from south, and you all assemble in a city, it's a fresh place. The environment is totally different. It's what time of the year, depending on which side of the country you are. So, firstly, when they all land up, there's a lot of acclimatization to do. Secondly, it's a very fast tournament. So, although we play only 14 games minimum in the period of 2 months, but once the tournament kickstarts, sometimes we are also amazed how quickly it just goes away from us. So, time's of the essence, and being a part of the medical team, my job is to keep the whole squad of 25 people fit and healthy. So, you know, when we keep moving cities, there's a lot of travel, the food changes, the water changes, the air changes. So there's a part of general practice which is required where people are falling sick, whether it is viral illnesses or, like you said, food related illnesses, different kind of, during my 6 years of work, I'd have to do 3 IPLs during COVID. So which in itself was a big challenge. We had created this bio bubble and looking after people. We've had a lot of players who had COVID. But for a normal IPL season, yes, it all starts off with, some amount of general practice. Secondly, as the season goes on, the workload increases. There's a lot of injuries which happen. So there is a whole spectrum of injury prevention to treatment. When I say injury prevention, things like their bone health, their general physical health, their vitamin status, all of these things matter because all of these things have some percentage which influences the chances of injury. And when they are actually injured, to speed up the process, work in conjunction with the physios. How do you decrease inflammation? How do you speed up recovery? All of these things matter. So the roles keep moving from the start of the season right up till the end of the season. And sometimes I don't think it is just limited to the player itself. Uh, we have a bunch of coaches who travel, the players' families are traveling. You know, if a coach is not well, even that is very important for the team. You want them to be, 100% ready. Most coaches are also slightly, they're not as young as the players. So sometimes they might require a little extra care. Players travel with their families. So, if a family member is not well, that is also going to affect the mental state of the player. So when I'm there, when I'm on the job, I'm looking after the entire bunch of people, the entire entourage of the team. And it is not just limited to players. So in the years which I have been there, I've, you can call it sports medicine, but I've literally done all specialties throughout my tenure. So it's fun and it's challenging, but I would say at the end it is very satisfying and rewarding as well.
Fantastic. So, what I come across, it's not a sports medicine. It's basically your like kind of whole medicine, all specialization to everything
Yes,
for the whole crew.
correct.
You have to take care of it. So I have an observation the way you responded. See, what happens like as you rightly mentioned about an IPL is a fast-paced tournament. There are certain players become very key players. There are certain players they are senior because of that they are also old and given so much of games they've been playing and it is highly demanding on them. So do you have any special focus on say a key player? He has to be kept fully always ready to play rather than following injury prevention. And is there any specific method you approach player to player? It's all the way it happens.
So, like you mentioned, there are some players who are young, and there's some who've been playing for a while. So there's always a history attached to everyone, that sporting history. Uh, Sometimes there are fresh options, and then we have newer players. So we kind of know that a particular player is predisposed to this kind of injury. It could be a recurrent muscle injury or a bone injury. So in that way, you know, he's come to me now. He's come to a part of our medical team. So if we know that a certain player is predisposed to this kind of injuries, we always like to carry out a barrage of tests right at the start of the season and to help him in whatever way possible, so that we can eliminate all the controllable factors. See, it's cricket ultimately, and if you get injured while playing, let's say if you are hit by a ball, that is something which I call as an uncontrollable factor. But there is a lot of controllable factors which we can take care of, which goes up to right up to maintaining the vitals, the vitamins, etc., and also the nutrition, the recovery. So in terms of guidance, the player behavior is a very important part of this. So we've been in the system long enough, so it rarely happens that we get a player whom we don't know anything about. So the idea is, it's not a one size fits all thing, but as a team we have a discussion, and we come up with a strategy of how we are going to manage a particular player throughout the season. As the season progresses, sometimes you find somebody who's in a rich vein of form, and that's very important to the success of the team. And if there are any habits or any things we point out, we don't wait for stuff to go wrong. It's always more of proactive work in terms of helping the player.
Very nice. So, Rizwan, if you could share, so you have been with the Indian team during the World Cup and also in IPL. Any specific experience or an interesting event which you remember that the sports medicine and your role played a pivotal role in handling a situation?
Hmm.
So that'd be very helpful.
I had multiple experiences throughout, the World Cup and the IPL. Of course, a lot of this is medical information, not privy, so without taking any names, but it often gives a lot of joy, a lot of self satisfaction when there have been cases where a player has been down with some kind of illness, and it's when a captain walks up to you and asks you that when will he be ready, and that is the moment. I mean, there is a lot of excitement for players representing, but in our heart, we feel a part of them as well. So there have been more than a couple of times, I think, when I've kind of told the captain with confidence that, he'll be ready for this particular game. And when that happens, when he's actually ready for that game, just that getting the tap or the pat on the back from your captain that saying, well done, or, just that nod of acknowledgement that you promised me this date and he is here.
See, how do you do that? See, because somebody has to, let's say somebody has a fever or somebody has an injury, especially the injury is a very dicey thing.
Correct.
So the captain is saying when he will be ready, then you're saying he'll be ready after 4 days.
Mhm.
How do you go about it? And throw with an example. You don't need to mention any name.
Correct.
Example that how did you work on that?
So basically, when we had somebody with an illness, see, when there's an injury, there's a lot of parties involved. There's a physio involved, there's a trainer involved. There are different stages. There's a stage where the physio takes care of the rehab, then hands it over to the trainer, and the trainer goes on to return to sport and all of these things. So there are multiple parties involved. But when it comes to illness is purely my department where I'm saying that this person is cleared to play and it's only one fitness test and he can go by. Cricket is a very skill-based sport, and we Indians are highly skilled in playing this. So when I say illness, it's about parameters. If I get some tests done right, we had an incidence where there was a fever and we got all the tests done. So in terms of markers, I knew that where this is heading. During that time, what I did with the player was, and luckily, the player was working with me for some time. We part of the team. I have had worked with him in the IPL, so having him in the other team also was not a problem. It's it's about being very honest and clear with the player. So you just walk up to them and say that okay, this is something which is not in your control, but I really want you to surrender right now. So just do what I'm saying, have these medicines. This is what we hit the timelines. I know, there are some other things you want to do, but rest is very important because the way they look at it, that, I'm not training, I'm not being able to go to the ground. These things can, play on the mind. So for me, the way I treated the player was I just didn't give him medicines and left him alone. There was a lot of thing which now when I look at big, it's a part of counseling somebody that how are we going to get there, and literally hand holding him through the entire thing. And that's when you and the player gets on the same page. When both of us realize that we are trying to achieve the same goal, I think that really helps. That way, I'm so happy that it's when the players are not doing well, I had a chance to spend a lot of time with him. So understanding the psyche of the players, that's when they are completely ripped and into their core basic nature. So I have seen that side of them, which I feel very grateful.
Fantastic. So, Rizwan, just moving into this. See, now the cricket is a sports and other sports are developing in India. Most of the sports in the last 10 years has grown in India in leaps and bounds. Like, for example, badminton, hockey, kabaddi, and football. Every sports is developing. Just think back the world cricket team. If you take the cricket team in 60s, 70s, 80s, even 90s, I don't know they had a doctor to travel with them everywhere. And I don't know that this much of specialization and depth was given to them. But now all of them are coming into the sport. And as a sports medicine as a discipline, from young athlete, those who are growing up, from the age of 10, 12, they start aspiring to be an athlete or a sports person. And then they've been a fully grown, representing the nation, international level and all of that. What do you think the medicine, sports medicine as a specialization is evolving? And what do you think the future involves in this? What kind of a future we can see sports medicine is heading towards?
So, to be honest, sir, when I took up sports medicine, there was nothing in India per se in terms of sports medicine for doctors. We've always had some great sports physiotherapists, but sports doctor was not something which was a very common term. This is something which when I went to study in London, that's when, it was when I went there, I saw so many practitioners and I was like, wow, this is amazing. So, the most simplest thing would have been to stay back in London because the setup is already there. But that's when I chose to move back. because I said that, there's a lot of work to be done. Over the years, I've seen it evolve, and now there are many sports medicine practitioners. Uh, of course, there is a great scope because we are a young sporting nation, and we have come up leaps and bounds, and we're only going to go better from here. So definitely a lot of scope, but the challenge is I see a lot of practitioners, young people who are getting into sports medicine as a profession, and they kind of see the glamour in it. Whilst there is a lot of glamour in it, I understand. But, at the end of the day, it's about helping. It's about helping the player who's playing at IPL, but also the player who's playing at a very small club, very close by to your clinic. And I think the day when you are able to not differentiate between both of them, I think that's when you will succeed as a person in this sport, because you can't be treating a name or what kind of background he's coming from. You just treat the player. And there is one thing which, again, people get into sports medicine thinking that, okay, I'm just going to be doing my medicine part of it. I think the sports is a very, very important part of it. You've got to have some kind of passion for the sport you're working with. And I see sportsmen from all different, badminton, football, volleyball, pickleball these days. But you know that cricket is my passion. So there is a little extra 1% when it comes to cricket. So it's important to find your particular sweet spot. I know of a friend of mine who's into kabaddi a lot. Okay. And I seen that he's really passionate about it. So you have to have certain amount of passion when you're doing this kind of a thing. That would help you push further. It will help you understand your athletes much better.
Good, Rizwan. See, I just want to ask you two advice for two sets of people. One is, see, when you come up to club level, like playing the league level, or you're playing for a state or a country, then there is certain amount of support system is there for physio, trainer, and doctor and all that. But 99% of players, whatever the sport, especially in cricket, this support system is not there when they're growing up.
Correct.
When till they reach the stage. Now, if for those kind of athletes, what is your advice? That how do they need to take care of? What are the resources? How they need to groom themselves in terms of fitness, training, overall well-being to be a great athlete? This is one. Second, in the recent times, when you look at last 7-8 years in India, taking a sport and playing on the weekend for the middle age and then more people with 40, 45 year, 50-year-old, they are suddenly becoming very much interested to play pickleball, you said. Everybody wants to play pickleball in the weekend. And everybody goes and plays tennis ball cricket in the weekend. And people play badminton. And what is your advice for them to take care of their sport? Because they have a lot of liking and everything. And they get injured by doing things wrong. So what is your advice for these two people?
Yeah, two absolutely very interesting and diverse questions, I would say. In the first part, let me go about that. As you rightly pointed out, sir, that most sports, 90% of people do not have access to good sports medicine healthcare when they are growing up. Okay. Uh, I really see that there is this gap in the market, as you would say that. So my advice to these athletes would be that, I know it's difficult right now, but just try and reach out to the specialist. You know, I know of a lot of people who are there to help. So don't think about, right now that, is it going to pan out? Is it expensive? Is it far away from where I am? I would say just reach out, because almost all the sports medicine practitioners I've seen, they are keen to help out. We always, whenever the athlete walks in, we always ask them their background, or always ask them. So, I would say on behalf of everyone that we are here to help. So definitely try and reach out to as many practitioners as you can. In the same question, I would say there's a big role of people like you in this, uh, somebody from Tata MD, who runs a healthcare business. If we could come up with something where, these athletes could reach out onto a system or a portal or some kind of FAQs, a digital area, at least some amount of guidance can be given. All of us are working for the betterment of the country, for the betterment of sports in this country. So the more talent which comes up, if with the right advice, I think it's better for the nation that way. So I guess we both have a role to play in this, and if we go according to that, there'll be some amount of success in this. The second one is very interesting. I also see this huge surge in cities like Mumbai, Bangalore. I've been to, and there's a lot of bookings for courts, badminton, pickle, paddle, tennis ball, cricket, in that. So I see a very good switch in culture. Suddenly, instead of spending more time in front of the TV, or partying. Earlier, I had a group of friends who used to say on Saturday, let's catch up at a restaurant. Now it's like, let's catch up for a game of football. So, as a culture, that's a huge shift. And I think that will slowly, eventually, in a few years to come, you will see developing a mindset to that fitness will get into a mindset. More than fitness, I enjoy the part about playing a sport. It's competitive at the heart of it, but it's still fun. You want to excel, and there's a rivalry, but there's also camaraderie in it. And yes, these people are getting injured. My advice to them is, what you have to see is, if you hit 40, you have to start respecting your body. Okay. Simple things like warm up, cool down, stretching need to be appreciated. If you book the court or the turf for an hour, you cannot be playing for an hour. It's always a good idea to come 5 minutes here, do your warm up, play the sport, and spend 5 minutes cooling down. You know, Everyone wants to maximize the time they book the turf for, so they want to just enter, throw their bags, and just start playing. And trust me, that's the point. That's the part where you get injured. So if you spend a little time, uh, you know, getting ready for your sport, that's going to be very important. And the second part, the same way, since you guys are also working professionals, you reach out to other professionals, because once you start improving, when you start playing, the first month will be a joy, pure bliss. But from the second, third month is when you will start getting serious about your sports, and that's when your injuries will start kicking in if you don't take the right steps. So reach out to professionals. Don't wait till the point you are injured. Reach out early and try to put a preventative plan in place.
Yeah, I totally agree. So to summarize, Rizwan, this is a very important point. So warm up, cool down, and stretching is very critical. And I also hear from you that if you're going to play a specific sport and if you're of an age, and please consult the right sports medicine doctor. These are sports you're playing, and what are the things you need to do prevent it. And also one more thing what I noticed, which is on my own knowledge, that you pick up a sport and start playing at the age of 40, 45, and you also need to play the sport in the right technique.
Correct.
Wrong technique also makes you to get into a lot of injury. So to take proper coaching and training in terms of how to play the sport, these are all very important to lead a very good sporting life.
Definitely.
And thank you, Rizwan. Thanks for this wonderful time and the insights. And we'll continue our conversation.
Sure.
Thank you.
Thank you so much, man. Thank you, sir.